with a little health knowledge because my head is ready to explode from what I see day to day when it comes to certain things that I would have hoped that most people would know. So I'm going to talk about it today. If you want to go on this journey with me, Tom, I would like to talk about.
Let's go.
Something I mentioned in another episode about the rice formula, but we kind of glazed over it a little bit. But we did mention that you shouldn't do ice anymore and blah, blah, blah. So in honor of that and in honor of the stuff that made my head want to explode this week, it's time to get real.
Get real.
All right, so I had mentioned in that episode about the man who came up with the rice formula saying, don't use ice anymore. Okay?
Oh, yeah.
This is him. Dr. Merkin. Now, the fact that his last name is the same as a toupee for a woman's crotch is besides the point.
That's what it's called?
A Merkin. Yeah. It's not spelled the same way, but
I'm learning a lot today.
And I hope all of you out there learn something today. And that's one to grow on.
Cheech and Chong and a Merkin.
I like to leave some things open for Tom. The surprise. I enjoy it. So, Dr. Merkin. Let me find. He was the one, so right here. 1978, I coined the term RICE. Rest, ice, compression, elevation for the treatment of athletic injuries. Ice has been a standard treatment for injuries and sore muscles because it helps to relieve pain caused by injured tissues, which I think I said it in that podcast, that ice helps you up here, which is pain. It makes you feel better. Coaches have used my RICE guideline for decades, but now it appears that both ice and complete rest may delay healing instead of helping. I scream this to people all the time, constantly. Stop listening to that crap and listen to your body and let your body do what it's supposed to do. In a recent study, athletes were told to exercise so intensely that they developed severe muscle damage that caused extensive muscle soreness. Although cooling delayed swelling, it did not hasten recovery from this muscle damage. A summary of 22 articles found almost no evidence that ice and compression hastened healing over the use of compression alone, although ice plus exercise may marginally help to heal ankle sprains. So in the use of ankle sprains, it may help marginally.
Yeah.
So what does marginally mean? Okay, you really don't have to.
Barely.
Right. So here we go. What does it say right there, dude? Please read it. Can you read it?
I can't. My eyes don't see that far.
Here, maybe I can make it a little bigger. Look at that. How's that?
Healing requires inflammation. Well, that if it's inflamed, that means there's blood flow to it.
Right. So let's see what he says. When you damage tissue through trauma or develop muscle soreness by exercising very intensely, you heal by using your immunity, the same biological mechanisms that you use to kill germs. This is called inflammation. When germs get into your body, your immunity sends cells and proteins into the affected area to kill the germs. When muscle and other tissues are damaged, your immunity sends the same inflammatory cells to the damaged tissue to promote healing. The response to both infection and tissue damage is the same. Inflammatory cells rush to injured tissues to start the healing process. The inflammatory cells are called macrophages, release a hormone called insulin-like growth factor, IGF-1, into the damaged tissue, which helps muscles and other injured parts to heal. However, applying ice to reduce swelling actually delays healing by preventing the body from releasing IGF-1. There you go, dude. Again, I tell people this all the time. Let's go down here. What's that say? Ice keeps healing cells from entering injured tissue. Applying ice to injured tissue causes blood vessels near the injury to constrict and shut off blood flow that brings in the healing cells of inflammation. The blood vessels do not open again for many hours after the ice was applied. The decreased blood flow causes the tissue to die from decreased blood flow and can cause even permanent nerve damage.
Ouch.
Ice also reduces strength, speed, endurance, and coordination. Okay, now this is where a lot of people use ice as well. Ice is often used as a short-term treatment to help injured athletes get back into a game. The cooling may help to decrease the pain, but it interferes with the athlete's strength, speed, endurance, and coordination. In this review, the medical literature found 35 studies of the effects of cooling. Most of the studies used cooling for more than 20 minutes, and most reported that immediately after cooling, there was a decrease in strength, speed, power, and agility-based running. Dude, now, when do most people use cooling? They use it wrong a lot of times. They use it before they work out or in between and then go back into working out. You're screwing yourself. If anything, you should be using it at the end of the workout, if anything. That's different. I mean, is this not crazy, dude? Is this not insane? This stuff.
Well, it makes sense because there's actually been scientific studies as well that most anesthesiologists say keeping the body keeping the body warm during surgery promotes healing and faster recovery from surgery. So a lot of times in the OR, they all demand what we call a bear hugger, which is a blanket warmer that blows warm air on their bodies. Because if they get cold and they drop below temperature, it lessens healing time. It increases healing time, and causes a lot more chance for infection even. So,
right,
which makes sense because like the same exact concept applies. If there's less blood flow due to reduced body temperature, then the macrophages as well as the white blood cells that are attacking anything that may be infection, or it just causes the whole process to slow down rather than take its natural course.
Perfectly said, dude. Perfectly said. Now, what is one of the other things that people usually do, are told to do sometimes, and usually do it themselves, sometimes too much? You have any thoughts? Besides putting the ice on it. What do most people not do for a while after they get hurt?
I don't know. I'm not, they stay off of it.
Thank you. They don't move it.
Yeah.
What does that say, dude? What does that say? Why is movement important for healing?
Because it also promotes blood flow, circulation.
The benefits of moving. When you injure yourself, your body immediately activates its self-repair function. White blood cells, hey, somebody just mentioned that, flood the injured area and begin repairing the damaged tissues and cells. Increased blood flow causes inflammation, and there's a reason why that you may notice swelling, stiffness, and redness around your injury. At this point, rest is a priority. Resting gives your body time it needs to begin the healing process. But too much rest can slow healing, increase stiffness, and other symptoms. Here we go. And this is what I tell my clients, dude, all the time. And again, I was inspired because Monday I had 2 clients come in. Both of them hurt themselves. Okay? In most cases, you can begin moving within 1 or 2 days of your injury, depending on the type and severity of it, obviously. I tell everybody that. I had a client come in on Monday. She twisted her ankle. It had been 2 days. There was no longer swelling in there. Thank goodness she didn't ice it.
Mm.
So I had her come in. When she came in, I tried to get muscles around it a little more relaxed and happy to move because they were all guarded because there was an injury there. And then I wanted her to move it through range of motion. I wanted her to get it pumping and moving. She was very afraid. She was limping on it and afraid. By the end of the hour, she was able to walk out normal on it. Was it miraculously healed? No, but I just promoted movement, range of motion, and healing by having her move.
Yeah.
Instead of what most people do is not move it.
Yep.
Now look what this is the things that it'll do by incorporating movement into your recovery. Reduce inflammation. Although inflammation is essential when an injury first occurs, it can cause lingering stiffness and pain when you move your joints. Movement relieves inflammation naturally, helping you to return to normal activity faster. Your body, it breaks up scar tissue to repair the muscle. So you're moving it. You're letting those muscles move in that range of motion. You're getting that blood flow in there. You're lubricating your joints. Joints don't get lubricated when they stay stiff. And again, by doing these simple little things that unfortunately most people are told not to do or don't do on their own, you're going to get chronic pain later on. And then you have a longer road back. And that's if you do the right things. And that's a big if. That's a big if. Because unfortunately, a lot of people are going to do a lot of wrong things before that, unfortunately. Now, my other client that came in, that other client was, had been having this pain in her back, blah, blah, blah. I don't have to get into the whole thing. But she went to the doctor, to the urgent care. It wasn't a kidney infection. Where it was located was kind of in that area. So we kind of wanted it to be, to make sure it wasn't that, because it was really bothering her. So we then, she went and had that blah, blah, blah. So they gave her a readout. I want you to show what the top things is that they're doing, that they want her to do. Can you read that?
Mm-hmm.
What's that top thing right there? Right here.
Rice.
So
Give me rice for my burrito, Gus?
Gus, they're still having you do the rice formula at urgent care. Now, this is a normal handout they're going to hand out to people. And they're still saying that. They're still saying that. And they're scaring people, wanting them to refer them to physical therapy. It's like, dude, you're going to delay. Here's what you're doing. By doing the top thing, you're going to make it so then they're going to have to go to the bottom thing. You're basically going to seal the deal because they're going to do that thing, and then they're going to wind up having chronic pain, and they're going to think they have to go to a physical therapist instead of going to somebody that knows what they're talking about, have them do some basic crap, and feel better.
It's a vicious cycle.
And the other client, when she went to the wherever she went to, the urgent care, paramedic, wherever she was, they said ice too. So they're still giving out this stuff at doctors to people when people should not be doing it. So people, I want to end with this. Please listen to my words. If anything, listen to my words. If you have an injury, if it's a broken bone, go to urgent care or the hospital. If it's an absolute torn muscle, like that muscle flapped up, you can't move that joint because the muscle's ripped, whatever, you go to the hospital, urgent care, whatever. But if you do something where you just about, ow, that hurts, give your body 24 to 48 hours and see how you feel before you run to the hospital. And in that 24 to 48 hours, you want to stay off of it for most of the first 24 hours. Let it swell up. Maybe every hour, kind of move it, minimum. Even if you can't get up, move the joint as best as you can, as far as you can. But stay off of it for that 24 to 48 hours. Then you need to start moving it. Then you have to let the body know it's okay to start moving it so you can promote even faster health. So please, don't go to urgent care and doctors and stuff for little ouchies. Let your body do what it's supposed to do. Then what you're going to do is you're going to add that compression and elevate for 20 on and 40 off for the next 24 to 48 hours. And then by then, you should be okay with just some soreness and stuff. You should be able to move it. So please, people, save your insurance for important things.
Yeah.
And if you are having chronic pain, find a good trainer that specializes in pain management. They're out there. That's what I do. There's other ones out there too in your area or online. I do online with Realistic Fitness. By the way, shout out to them for sponsoring this podcast. I work with people to help them go wherever they're at. Chronic pain, bad movement, not very mobile, not doing things, not wanting to do things, hate doing things, to get them to a balance. And then a person can go wherever they want from there. They can stay there or move on. It's totally up to them. So find that person that'll do it. And again, Tom has talked about things helping with him, and maybe we can at another point get into more stories about that. I can give you more client stories of how I helped people who had pain for years feel better just through movement, not even having to go to the gym, just doing things at home, doing the bare minimum consistently. That's it. Bare minimum consistently is the key for most people just to be healthy and feel better and move. I really wish people didn't have to knew that they didn't have to be an athlete by exercising and moving. They could just move better and feel a little better. And then maybe reassess at that point and see how you feel at that point. I really wish more people would do that. You have any final thoughts, bro? I went off on a tangent. You have any final thoughts on that subject?
No, I mean, besides previous testimony, no, not really. I mean, I could have just laid up and curled into a ball and been like, oh God, I can't move. I can't do anything. I need to rest. Rice. But it's like, you got me moving and made me do the right movements to build up the muscles around it. And it helped my injury. And it was like almost instantaneous. So,
I was real happy about that.
That was a testament to that, because I wouldn't have been able to go meet up with that girl at that time. So
right, exactly.
It definitely helped me out big time.
There's a happy client right there.
Yeah, that's one instance, and there was the other instance too. Even with my shoulder, it was the same thing. It wasn't there was no rest ice. That it doesn't get you anywhere. Like if you're not going to address the problem, or like my teacher used to teach me when I was in the medical program. She basically said, I don't take ibuprofen. I try to take NSAIDs or aspirin. I try to take it as little as possible, because if you take it all the time and you're constantly numbing yourself, you're never going to know. And what does ice do? Numb yourself. You're never going to know.
Your only communication. Your only communication with your body is pain.
Pain is a communicator, and you have to remember that. And you're never going to know where you're at. You're never going to know, exactly where you're at unless you stop it and give it range of motion. But do the right things. Obviously, if you don't know what the right movement is, you could further injure yourself also. So you need somebody like you to give someone a nudge in the right direction of what to do. Like initial elevation. Elevation and ice and stuff to like for instance, we all, us who have, growing up, or when you have kids, like the first knot always looks the worst. I remember my ex-wife and everyone, the in-laws and my mom and all the girls going crazy. Oh my God, look at the knot on his head. He fell. Oh my God. And you're like, yo, relax, dude. It'll go down. Just let's give it some time to see where we're at. You put a little ice on it or whatever. If you want to take it, if you have to give them an ibuprofen or whatever, if they're really crying like a little child, but usually most knots would go down, and like it looks so bad at first. Even sometimes it looks like it's going to bruise. And then it's like within 10, 15 minutes, you're like, oh, it looks just like a little scratch now. It's like gone. It like
resolves itself. you saying humans want instant gratification, dude? Is that what you're trying to tell me?
Instant gratification, yeah, but I mean, hey, you want to shut your kid up when they're crying, you're going to put ice on it because it makes it feel better. Okay, I get it. But there's been plenty of times where you like, oh my God, that knot is going to look so horrible. And then within 10 to 15 minutes, it resolves itself. It resolves itself on its own through your body's natural healing, factors. And you're like, oh, wow, I thought he was going to look like the Elephant Man, like my nephew. I thought he was going to look like the Elephant Man. He had a knot on his head. It's like, it's gone already. Whoa, what a difference.
Right, exactly.
And it's like, did you have to go to urgent care? Did you have to freaking lose your mind? Like, he didn't have any concussion symptoms or anything crazy. Like, wasn't knocked out. Like, you know what I mean? But it's like, your body wants to heal. Your body is trying to heal. And cold the ice will slow that down, and that is a hindrance more than a help in the end.
Right. And it says it, tissue will die. Tissue dying is not a good thing. That's not a good thing.
Well, that's why
tissue does.
Well, I don't know if you ever heard this thing called frostbite. It's not a good thing.
No, it isn't. I don't know. It's 2023. Yeah. Maybe it's good. I don't know.
Yeah, right.
So, and one more last thing I just want to throw out there.
These days you could be a border collie. So
yeah, like that Japanese guy that we talked about earlier
for 14 grand.
Yeah, exactly.
There you go.
Check out the beginning of the podcast if you didn't. One last thing I just want to touch on for 1 minute is people love going for shots for cortisone and lidocaine shots and stuff like that to try to make the pain feel better. Yep, all that stuff, all the different things. Let me just point out to everyone that you can only sometimes get, with certain things, you can only get them a couple times a year. And there's no guarantee. It depends on the individual, how you're going to react to it. So you can go through all this and it'll last 2 weeks, or maybe it'll last 12 months. You don't know. And if the person doesn't give you the shot right and it doesn't go into the muscle and it goes into your bloodstream, then you can get toxicity and all that other crap. So
big problems.
Just to let you know, you're not fixing anything. You are not fixing anything. All you're doing is shutting off the service light on your car. You didn't fix anything. You just shut off the service light. That's all you did. I just wanted to point that out.